What do you feel are some of the most important or pressing issues in Indigenous health and health research right now?
Right now.
Right now, in this moment.
Right in this moment, in this room. The most pressing issue in Indigenous health and Indigenous health research right now is the lack of self-determination. And from which that, everything else flows, right? So as we talk about working within a colonial institution, an academic institution, we also work in a colonial health system in general, in the most part. And the research system is also colonial.
If you look at the health disparities that exist between Indigenous people and non-Indigenous people in what we now call Canada, they can all be traced back to colonialism. So the Indian Act, the reserve system, the residential school system, the Indian hospital system, and forced and coerced sterilization of Indigenous people with uteri are all some of the legacies that trickle down from colonialism. And in fact, only 2 of those are no longer in play, which actually tells us that colonization is actually still happening today. And so of course there are all these health disparities, and that leads us to all of these social determinants of health that inherently plague most of our communities. How can you be healthy and well if you don't have access to stable housing and clean drinking water, and if schools on First Nations are funded at 70% of schools outside of First Nations? It's essentially impossible. I think a big challenge in Indigenous moving research forward in Indigenous communities is trying to impose a colonial research structure on Indigenous communities, and just the fact that typically large research teams from colonial institutions really don't have a great concept about the need to work with communities, right? Nothing about us without us. And they struggle to engage to bring Indigenous folks in to start co-developing research questions as opposed to imposing research studies on Indigenous communities.
I hope with the Waha project, my hopes is that the chiefs and the councils and the community come to the table and say, this is how we want our healthcare to be, and this is how we want our children to be trained, because this is what we need, not the southern dream that has no idea what the northern reality is like.